Hello, ladies. Today we're going to talk off the cuff, totally outside my normal thing, okay? And we're going to talk about what happens to your vagina after pregnancy, okay? Some of you may or may not know that I used to help deliver babies. The mother does the majority of the work and we just kind of help, okay? We don't deliver babies per se, we help. Unless it's like a C-section, then obviously surgeon, does things a little different than the, the normal vaginal delivery. But so there are things that you may or may not know about what happens to your lady bits after having a child. So that's what we're going to talk about today. You might think if you see changes, you might think that that's not normal. Is my body flipping out? Do other women go through this? Bear with me, ladies. Okay. All right. Sorry about that. You know me, I get to thinking about other things and then, All right, so let's get to it, shall we? Sorry about that. Let's go. Okay, so your body goes through a lot of changes during pregnancy, which obviously, right? Your vagina, abdomen, breast, skin, and hair can all look and feel different during and after pregnancy and birth. Some changes are clearly visible, like that dark line that can show up on your stomach, which is known as the linea nigra. Others may not be as visible, such as changes to your vagina after birth. Many pregnant women wonder how pregnancy will affect their vagina and if delivering a baby will permanently stretch it out or cause incontinence. Growing an entire human being isn't always easy, and your body will change as a result. However, while your vagina will be impacted by birth, most of these changes are temporary and or can be lessened by interventions like doing pelvic floor exercises. Learn more about your vagina after birth. Okay. So, post-pregnancy and birth vagina concerns. Your vagina is a structure that is inside your body. Well, we kind of figured that. Anything that you see on the outside, including your labia, the folds or lips, clitoris, and mons pubis, which is the mound where pubic hair grows, are parts of the vulva, not the vagina, okay? The vaginal opening is where menstrual blood passes and the baby comes out during delivery. Potential changes in the vagina after birth include the following. Obviously, stretching, obviously. Your vagina stretches during birth in order to be able to let the baby pass through the birth canal. One study found that the pelvic floor muscles involved during birth can stretch more than 3 times their normal amount. Okay? The vagina is designed to stretch and accommodate a baby. After delivery, the tissue will usually shrink back down to its pre-pregnancy state. The vagina may get looser after having a baby as a result of the pelvic floor muscles around the vagina getting stretched out. This change can be more pronounced based on several factors, such as how large your baby is, any complications during delivery, and how many babies you have already delivered. Genetic factors and being overweight are also influential. Practicing pelvic floor exercises like Kegels can help strengthen your pelvic floor post-baby. Talk to your doctor to find out when you are healed enough to start these exercises. So basically, if you practice when you urinate, practice holding the urine while you're, just to practice, get the feel of it, and then release, hold, release. Those are the Kegel muscles that you are strengthening that help strengthen your pelvic floor muscles, okay? Change in appearance. Most changes in the appearance of your vulva and vaginal opening that can occur after pregnancy are only temporary, okay? Hyperpigmentation, however, may be permanent. Giving birth also may cause swelling or discoloration from pregnancy or the process of giving birth. The swelling and discoloration can occur whether you have had a C-section or vaginal birth because of pregnancy hormones. Depending on the duration and intensity of labor you have been through, the labor process itself can lead to swelling. Instrumented delivery, such as forceps or vacuum assist, also may be influential in swelling, which makes sense, right? Tears or episiotomy healing. Stretching, tears, and rips can occur around the vaginal opening during childbirth. These injuries should heal with a little time. While less common than they used to be, episiotomies are sometimes necessary to help make room for the baby. An episiotomy is when a doctor or midwife makes a small incision in the perineum, which is the skin that connects the anus to the vaginal opening, to create more room for the baby to pass through. In general, an episiotomy heals in about 3 to 6 weeks, and in some cases can leave a scar. The amount of scar tissue will depend on how much of the perineum was involved and other injuries to the tissue. This scar tissue is not typically noticeable and does not affect your vagina's appearance or function. Okay. The use of forceps as medical intervention during childbirth can cause injuries to the vaginal tissue. Most doctors no longer use forceps. However, if your baby needed forceps to come out and you're still experiencing vaginal pain at your first postpartum checkup, bring this up with your doctor. In general, your vagina's function will not change as a result of pregnancy or delivery. However, sometimes the pelvic floor muscles that control the vagina are affected. These muscles surround and support the bladder and vagina, so they can be injured or weakened during birth or from the strain of pregnancy. In some cases, damage to the pelvic floor muscles can lead to complications such as bladder dysfunction or uterine prolapse. Okay. Obviously, if anything like this happens, you obviously would talk to your doctor, would know about it, or if it happens outside of your doctor's office, you let them know immediately that there's something going on that's weird, and they'll get you taken care of. Urinary incontinence. One of the most common issues that women have after childbirth, for example, is urinary incontinence. Some women find that they leak urine, especially with strenuous activities such as jumping or sneezing. This is common, but it's not normal or untreatable. Ask your healthcare provider for suggestions on strengthening your pelvic floor muscles to prevent incontinence. Okay. So apparently, once you strengthen those muscles, it'll help like a host of other things as well. It's kind of like a snowball effect. It'll help you all the way around the board with support of your bladder and your what? Oh, I just lost where I was reading. I mean, anyways, it prevents incontinence when you strengthen those muscles. Like I said, anything that you notice it's been going on for a period of time, or you're just worried, talk to your doctor, your nurse, and they will tell you what's normal and what's not normal and what's a good thing to do to combat that issue. One study found that 91.3% of women reported some kind of sexual problem after having a baby. That's a high percentage. 91.3%. The reasons can range from sleep disruptions from the baby to how a woman feels about her vagina. The nerves in the pelvis can also be damaged or changed during the pregnancy and delivery process. The pelvic floor muscles that worked so hard during birth play a role in sexual function and orgasm too. Some women do experience a lack of sexual satisfaction or feeling like their vagina doesn't quite work the same way it used to as a result of, again, weakened pelvic floor muscles. Painful sex can also be due to dryness caused by the hormonal changes of pregnancy and breastfeeding. This dryness is temporary and can be treated with lubricants. If sex is very painful for you after having a baby, talk to your doctor to rule out any complications or infections. Okay. Fortunately, certain exercises can help strengthen weakened pelvic floor muscles. Kegels, which is Kegels if you wanted to research that. Simple repetitive squeezing or tightening of the pelvic floor muscles provides some benefit. So the muscles that you would use to stop the flow of urine, that squeeze that you do down there, those are Kegels, okay? You don't have to do that in the bathroom, but you can practice it. When you use the bathroom, you can practice using those muscles to stop the flow of urine, but those are the muscles, so you'll know where to focus on when you tighten, okay? You can, good thing is you can do it anywhere at any time. It's not like someone's going to know you're doing it. If you do it in public, nobody's going to know and go, what is up with her? You know what I'm saying? Like, it's private. Okay. Other exercises that use your core muscles are safe to perform during pregnancy and can help engage the entire pelvic floor to keep it strong. Don't start any new strenuous exercises, of course, but if you've been exercising before your pregnancy, keep it up because there are many benefits. And if there's any, I'm not a doctor, so I'm going to refer you to your doctor should you have any questions. And if you are accustomed to working out and you start working out after the baby and you're starting to notice muscles that didn't hurt before or anything that's going on that you did not feel before you had the baby, for sure, always contact your doctor if you have any questions, or your nurse, okay? Studies have found that postpartum pelvic floor exercise programs are very helpful in decreasing postpartum urinary incontinence and pelvic floor strength. The most effective programs are run by trained health professionals and include a vaginal resistance device. It may be difficult to do these exercises on your own. If you are struggling with weakened pelvic floor muscles, talk to your doctor. Many doctors and insurance companies are recognizing the benefits of supporting women through and after pregnancy to prevent any future problems, which is smart. Reparative surgery in severe cases. Surgery may be needed to repair the pelvic floor and support any structures that may have dropped, such as the uterus or bladder. Okay, so this comes from Very Well Family. That's the name of this article. Let's see. Okay. In general, the vagina is a structure that is designed to accommodate a baby and will not change significantly in structure or appearance after pregnancy. In some cases, however, as a result of damage or weakening of the pelvic floor muscles, a woman might experience postpartum changes such as urinary incontinence, bladder dysfunction, or pain during sex. If you experience any of these changes, do not let embarrassment prevent you from seeking help. These issues are very common and often highly treatable. Speak to your doctor about treatment options. Okay? So it's Very Well Family, and I would try to remember to put it in the description bar. And this article is written by Chowny Brucey, and I'll try to remember to put that in there. She's a registered nurse. And this was also medically reviewed by a Dr. Alyssa Dweck. She's an MD. Okay, so this isn't a random article that somebody decided to write. These are medical professionals, a nurse who wrote the article and a doctor who oversaw the article to make sure that it was accurate. And it is verywellfamily.com. And what happens to your vagina after pregnancy. Okay? And like I said, I would try to remember to put it in the description. You know what I'm saying? So, and I read another article that said that your vagina can change. Like your lips can change. One of them may be bigger than the other because of swelling. And again, hyperpigmentation down there. Our bodies are not, I can't find that particular article, so I apologize. But our bodies are not completely symmetrical anyway. So it's normal for one breast to be a little bit bigger, one arm to be a little bit longer than the other, one leg could be slightly longer than the other leg. We're not completely symmetrical. So that stands to reason that you wouldn't be completely symmetrical down there, so your body isn't weird, or you don't need to freak out if it's totally different. Like I said, one side looks bigger than the other side or anything like that. That's totally normal whether you've had a baby or not. And I can't emphasize enough that if you see any drastic changes that worry you, by all means, reach out to your nurse or your doctor, make an appointment or whatever you need to do. I would just ask the nurse, because, a lot of times if you call your doctor's office, you just request a nurse and that person will help you right there on the phone. You wouldn't necessarily have to make an appointment unless what you're describing to them, they're like, oh, I'll tell you what, let's take a look at that. Why don't you make an appointment? So they'll tell you what you need to do. Okay. So I was an EMT back in the day, and I helped deliver babies. In fact, I wanted to be I wanted to be a midwife, and I considered going to school for that. But Missouri did not have a midwifery program at the time, so I was not able to do that. In retrospect, it's good that I didn't, because I have chronic pain, right? And when you're in labor, it could last a long time, right? Especially for first-time babies, although they can sometimes come fast. The baby does what it wants to do, okay? But I would have liked to have done that. But when you have chronic pain and your patient is in labor for a really long time, like, what are you going to do? You got chronic pain and your patient's in pain. You give her oxygen, give yourself oxygen, give her oxygen, give yourself oxygen. That ain't going to work, okay? Can you not push the baby out? Because I'm in a lot of pain right now. Just bear with me. I know you having a baby, but hang in there, because I'm hurting too. That ain't going to fly. That's not going to work. But anyway, I will tell you, if I haven't told you this a long time ago, I'll tell you, and maybe you're hearing it for the first time. I don't know. But anyway, so I was working at the Whiteman Air Force Base, helping on the OB ward. I helped moms before delivery, after delivery, and during delivery, it just depends. And, at one point, and I've talked about this in another video, a while back, we had a patient on her hands and knees, and we were trying to put her in that position to open up the pelvis to let the baby come down. And I saw crowning. Nobody was in the room except for me, because the doctor was chilling, the nurse is chilling, because they figure it's going to be a while, right? Well, I see crowning, and I said, I need you to lay down. She's trying to lay down, but she's having contractions, right? It's kind of hard to do anything when you're having a contraction. So I said, I need you to lay down. More crowning. I need you to lay down. More crowning. I need you to lay down now. No sooner did she lay down, the head popped out. And I was the only person there. And thank God I had gloves on, because you don't necessarily think. You just reach so that the baby doesn't go flying across the room, because that would not be good, okay? So I put my hand under the baby's head, gloved hand, thank goodness, put my hand under the baby's head, and I was so excited that I temporarily lost my voice, and I said, I need a bulb syringe. You need a what? I need a bulb syringe. Bulb syringe, you guys who've had a kid, you know what this is, right? It's the little air bulb thing that has a nozzle on it. I don't really know how to describe it. They squeeze and they clean out the mouth and they clean out the nose so the baby can, any secretions, they clean it out. But I'm like, I need a bulb syringe. I lost my voice. It was hilarious. They're like, whoa, the baby's coming out. Yeah, kind of. Another time, you know how you want something real bad, and then when you get it, you're like, oh, I don't know what to do now, right? So I have been bugging the med tech I want to be the first one to hold the baby, and I've been bugging him to pieces. He was up to here with me, with begging him. So finally he said, okay, we're going to do it today. And I'm like, we don't have to do it today. No, we're going to do it today, because you've been asking and asking and asking, so we're going to do it today. And so, oh my freaking God. Okay. So he said, I want you to hold your arms like this. Doctor's going to hand you the baby. Hold the neck, and support the feet. The baby's going to be slippery. Okay. I'm like, okay. So doctor handed me the baby. Honey, I was in such awe and amazement that I forgot to put the baby in the warmer. I just stood there in complete amazement, staring at this beautiful baby. I'm just staring, like the rest of the world disappeared. And he's like calling me. I'm like in a zone. He's calling me again. I said, huh? He said, you got to put the baby in the warmer. Oh, yeah, that's right. Okay. It's such a miracle. It's such a miracle, it's a beautiful thing. And I lost my mind temporarily, and then I got back on track, put the baby in the warmer, and we were good to go. But yeah, I just stood there like, oh my God, wow, the warmer. So yeah, I would have liked to have been a midwife. Like I said, I had no idea that my body was gonna go. You're funny. No, that's not gonna happen. I have assisted with C-sections. So when the mother was in the OR, I would basically hold her abdomen and kind of gently press it towards me to take pressure off of the abdominal aorta. And so I would do that and comfort the moms who were scared. Some of them were having a C-section and they were not prepared for that at all. And so I'm pretty good at consoling people and helping them through it because, I mean, it's scary, being in the hospital period is scary. And if you thought you were going to have a vaginal delivery and then all of a sudden things flipped, or they eventually flipped and your bubble got burst with that, you're like, what? That wasn't the plan. But so, sometimes they would get a little bit emotional and I would just help them through it. You're going to be fine. You're going to be fine. Look at me. You're going to be okay. I'm scared. It is scary, but you're going to be okay. I got you. You're going to be okay. So, one of the things that was really amazing too is, I'm getting sentimental now. Don't you dare tell anybody. I'll get really mad. Anyway, women would stop me like 4 or 5 years later. They'd see me in the store and they'd be like, you helped me when I was in labor. I'm like, I did? Yeah, you did. Here's the baby you helped with. And now this child's like 4 or 5 years old. And I'm just like, oh, wow. Okay. Because you don't remember everybody, but they remember you, honey. They're in a lot of pain. They're in horrific pain and pushing a baby out. They freaking remember who was holding their hand, who was wiping their forehead. They remember all of that. So, and I told you guys this before, I'm warm, so that's nothing unusual. So what else is new? Anyway, I've told this on other videos before. There was a couple that came in and I told them, get comfortable. It's going to be a while. It's your first baby. It'll probably be a while. Yeah, that baby had other plans, honey. We had helped deliver, either everybody or nobody. I don't understand that. It's weird. Everybody goes in labor at the same time. It's just weird. So, like I said in another video, I was my boss's nanny. So I took care of her kids. And then when she came home, I would go to the hospital and help them. And so, it was just insane. I had told this couple, get comfortable. It's going to be a while. First baby usually takes a while. And I'm exhausted because at that point, I was working the equivalent of 2 full-time jobs at the same time. And my body was really tired of me doing that. But anyway, move right along. And so I'm ready to go home. My brain is peanut butter. I'm ready to go home. And this baby's going to be a while, so I'm out. I'm walking down the hallway. Her arm is in the air and she's going, and I'm like, I'm not going nowhere. Because if I started labor with you, I generally stayed with you until the baby was born. I didn't want to, bond with her during labor, and then halfway through, well, peace out. I hope it works out good. I gotta go home. I mean, that's kind of rude. So I would stay with them until the baby came out, even though it may be a while, it might be a long while. I stayed. And I just felt like I could leave with this particular scenario because this is going to be a while. Oh, yeah. Baby had other plans. Okay. So, it was exciting. It really was. It really was. My coworker was giving me grief whenever he's like, I'm jealous. I didn't get to support the baby when it was coming out. I said, nobody told you to go to the restroom when you went. That's on you. I also have done, the nurse allowed me to, and I asked the patient for permission. Uh, the nurses do, obviously, right, internal exams during your labor to see where you are so far as your dilation. Your cervix will dilate eventually, hopefully, 10 centimeters, okay, to allow the child to come out. Obviously, you have to push and everything else, obviously. And so the nurse allowed me, and the patient allowed me to do an internal exam while she's in labor. And it's exciting because, and I don't talk about this. What am I doing right now? Anyway, as I felt inside when the baby turned, it felt like electrical sparks. Like, it was the most fascinating thing. It was just so incredible. Amazing. Absolutely amazing. So, yeah. Yeah, I would have liked to have done that, but that was not to be. As it was not in the cards for me to be a midwife, but it would have been nice if my body had cooperated. So, with that being said, okay, I'm not gonna get emotional. I'm not. If you have a dream and you have the desire, you have the physical ability and the determination to do whatever it is, medical or non-medical, doesn't matter, okay? And you're like, you got it in your mind, I'm going to school for this, I'm going to make this happen. Please, bear with me, give me a minute. Give me a minute. I did not expect these emotions. I did not. Please follow your dream. Regardless of what it is, follow your dream. So you're going to have this thought in your head and you're going to think, well, I should go to school for this because this is my passion, okay? Whatever it is, computers, medical field, or, whatever it happens to be. Pharmaceutical representative, whatever it is, whatever, auto mechanic, whatever the heck your dream is. Don't hesitate. Don't hesitate to do that because, if your body fails you, you had all these years that you could have done it and now you can't because of an accident. Like in my case, it was because of, God, what is happening right now? What is happening? You never know when life changes drastically and you have zero control over that. Whether it was a car accident, you became paralyzed for whatever reason. And it can happen to anybody. It can happen to anybody. I would give you an example. I don't know them personally, but I know of young people like, 18, 19, 20 years old, and they were surfing. And because they had their body in a rigid position, they ended up having a crisis and had to lay on the beach because their legs became paralyzed because, and they found out, doctors were confused. They're like, you're young and athletic, and there's no reason for you to have any type of paralysis. What?
I use the bathroom.
Huh?
I gotta use the bathroom.
Okay, can you wait? Don't you have one upstairs?
No, I need your tweezers and everything down there.
Here, use this.
No, I'll come down there when you get done.
Okay. Sorry, guys. And so they would lay on the beach and their legs are paralyzed. And doctors are like, what? They're young and they're athletic. How the heck are they paralyzed? And then they discovered that the rigid position that they were holding their body in when they were surfing, it pinched a nerve in their back. And so it caused paralysis. So anything could happen. I think they recovered. I can't remember, to be quite honest with you. I think they did recover, as far as I remember. But it's just this weird, freaky thing that happens out of nowhere. Anything can happen to anyone at any point in time. And you don't want... Now, I eventually went back to school. What I would have preferred to have done in retrospect, right? Hindsight's 2020. I wished I had gone right after high school, because your brain is still in the process of learning. It's receptive to learning. I had this mentality that I'm going to go to work because school don't pay you to go to school. Not usually. So I wished in retrospect that I had gone right out of high school. But I didn't know what I wanted back then either. I didn't find out till... I'm a late bird. I didn't find out till way later, like 2000... Let me see. What year was it? 2005, 2000... I'm not sure. Somewhere in that time frame, 2004, 2005, I considered the midwifery thing. But like I said, there wasn't a midwifery program at that particular time. At least not in Missouri. There may be one now, but my body ain't down for that. Okay. Like I said, oxygen for me, oxygen for the patient. That ain't gonna fly. It's just not gonna work. Can you deliver your own baby? Because I can't get out the chair right now. That's not gonna work. But anyway, follow your dreams. While your body is receptive, while your brain is receptive, go for it. Because you never know if the clock is ticking. You just never know. You never know. So, follow your dreams. Reach for the stars. Make it happen. And, it'll open up a door of unlimited possibilities depending on the field that you choose. Okay? So, anyway, you guys take care. Talk to you later, and I hope this article was helpful to you.